Let's go to the Obama administration's healthcare reform, and which follows perfectly from this inspiring.
I see our time is up. I'm sorry.
And I know I asked you in advance whether you would say what would have been on your wish list from your noble attempts to bring about such a plan. And I know you have no interest in giving me that answer, but what's a framework by which the current Republicans and others challenging that plan, how would you like them to see it, and us to think of the current Supreme Court term and the cases and the threats that are now being brought to it?
Yeah. Well, I think, let me put the Supreme Court aside, as President Gore had to do, and say that I can't predict what the Supreme Court will decide to do or intervene in that may or may not have precedent. But putting that aside, look, I think, being a policy wonk, I could critique anybody's policy to death and enjoy it. But I support what President Obama has done. I think he was courageous in getting it done. I know as well as anybody how difficult it is to get done and how easy it is to grandstand and sort of demonize an effort like this. And I applaud his courage, and people like Nancy Ann DePaul and others who worked on this, I think, did a great job in getting something done, and in an environment that's very, very difficult. Is it perfect? Of course not. Is it going to have to go through changes? Of course. Will it evolve over time? Of course. But the fact of the matter is we have a system that's broken, and I want to be very clear about the way in which it's broken. We do deliver the best health care in the world in this country. What's broken is our system of financing health care. And what's broken is the fact that that best health care that is available, there's a whole lot of people in the country that can't access it because they don't have the money in the way the system is working, okay? So this is not a critique of our health professionals or our health system in that sense. It's a critique of the way we organize and finance. And, where we're uncompetitive, I mean, if those of you who run businesses in this room, if you had a business, we're spending over 17% of our GDP now on healthcare. The next closest is 11, 12%. All the other developed countries cover everybody, we don't. Their health outcomes, whether it's infant mortality, whether it's life expectancy, everything else, are at least as good as ours. And I know there are extemporaneous factors to that and so on, but basically, we can't argue that our outcomes are better. They're better in certain specific ways, but not generally. If you were running a business where you were, almost twice the cost of your competitors, and your competitors were delivering a product that was as good as yours, you'd feel like you had a problem. Now, what is the problem? Well, the first place is that we spend 35% of the total system cost, every dollar in health, on administrative cost, when other people are spending 10 or 12%. And it's mainly due to the way we finance and regulate our healthcare. And in studies we did in my home state of Rhode Island back a while ago, between 1980 and 1995, if you looked at the revenue coming into the average doctor's office, at the beginning of the period, about 18% of it went to administration. By the end of the period, 52% went to administration.
And that period was how long?
That was about a 12-year period. And the reason was because doctors had to get into the business of managing different insurance plans and essentially having different, software programs, and then appealing this and appealing that and applying for this and applying for that. And also the national regulatory infrastructure increased dramatically. And then the malpractice piece was there too in the lawsuits, but the regulatory requirements on hospitals or so. And then it became very complex. I mean, when we did our study in Rhode Island, 2% of all the operations that were scheduled, the doctor was there, the patient was there, the paperwork didn't show up. And so the operation was canceled, literally 2% over a year and a half period. 30% of the admissions to hospitals were from adverse drug reactions from different drugs prescribed by different doctors, mainly among elderly people. There's a series of administrative things and financing things we have been doing in our system, which are a nightmare. And my mother-in-law, when she got cancer, and I knew something about the healthcare system and about health financing. And I don't know how many days it took me, literally days of paperwork to get coverage she already had coverage, I'm sorry, but to get coverage honored that she had as she went through different stages of the process. And if I hadn't known everything about the system and had the clout to sort of fight it, and here, you know, average families in the United States, they have people who are ill and they're worried about the illness, and instead they're having to spend half their time worried about, am I going to get paid for this or not, and these forms and those forms, and did I fill them out right, and everything. It's a goddamn nightmare. Now, what I would ask the people who are opposing what President Obama is trying to put in place to say is, you know, if you're wealthy enough, maybe you can avoid this. But this is the reality that we're facing in this country. It is a shame. It is the only country, developed country in the world, even among middle-income countries, that has this kind of problem, and it's got to be fixed. And at least President Obama tried to do something about it.